Hello, my name's Danielle Banks. I'm one of the nurses working at Davies Veterinary Specialists. We're a small animal referral practice based in Hertfordshire. And today we're going to be talking about Veterinary Nursing Awareness Month, which is in the month of May. And I'm joined by my colleagues, Hannah Perry and Nicole Neat. And we're just going to be giving you today a little bit of an insight into referral nursing, how we all came into nursing and why we continue to work here at Davies Veterinary Specialists.
Hi, I'm Hannah. I've been working here at Davies for nearly 17 years, initially as a rotating nurse, but mainly for the last 15 years as a wards nurse. For the last 4 years, I've been working as a ward supervisor. I initially came here to Davies to see a wider range of cases, to see a lot more interesting cases from different disciplines. And we get to see lots of long stay cases here, which we can provide continuity of care and see the cases all the way through. So that's me.
Thanks, Hannah. What about you, Nicole?
Hi, I'm Nicole. I worked in general practice and trained there for 2 years. After a year qualifying, I really felt that I wanted to learn more, and I'd heard about Davies Veterinary Specialist and the expert specialists that work here, and with all the expert equipment that they have and the exciting cases that they see, I really wanted to just come here and try and see what they got up to. I came here and worked in anaesthesia for a couple of years first, and then I had children. It was really lovely to be able to come back as a rotating nurse, and then I decided to specialise in theatre. I'm currently now in theatre, and I have been for the last 2 years permanently, and I am now a theatre supervisor. I've been working here for 13 years.
So many of you may not be familiar with what a referral practice is. What happens is if your pet is sick, you would naturally go to your normal general practice, but sometimes there may be a problem with your pet, which means that you need some slightly more expertise, people who are specialising in particular areas. And along with specialised equipment. So your pet may be referred to us, so you can't come to us just as a routine, it's something that you're referred to. So just to give you a little bit of a background there, and as we've mentioned, Nicole and Hannah first started working in general practice. So can you tell me a little bit about how you actually become a qualified nurse, please, Hannah?
So there's lots of different routes that you can choose. Here at Davies, we apply the apprenticeship route, so our nurses go to college 1 day a week, but you can also go to college and do the degree level nursing, or work in general practice, going to college 1 day a week.
Thank you. Now I know, Nicole, that you've taken on some additional qualifications while you've been based here at Davies. Can you tell me a little bit more about that and what your drive to do that was, please?
Yes, during the nursing, going to college and doing the nursing qualification, I found that I really loved anaesthesia and surgical nursing. So I looked into seeing what else I could do, and there is a diploma that you can do in advanced veterinary nursing. So I decided to look into that, and I have done the diploma in advanced surgical nursing. And because I liked it so much, I decided to do the diploma in advanced medical nursing as well.
So broadly speaking, at Davies, our nurses work within 3 areas, covering theatre, diagnostics and patient care. We've already mentioned that Hannah works within wards with our patient care area. Hannah, can you tell me a little bit more about what your day-to-day role involves, please?
Yep, so in wards, we generally have 2 shifts. They are 7 till 3 and 12 till 8, with also a 1 till 9 shift in ICU. And then overnight we have our fabulous night team, which work 7:30 to 7:30, so completely overnight. During the day, we start at 7 and we come in and take over from the night team and do a handover. And then the day kind of follows a pattern of feeding, medicating, walking out, with obviously lots of nursing in between that, including emptying drains, chest drains, wound catheters, indwelling urinary catheters, doing lots of observations of the patients. We then do another handover at 12 o'clock with the late shift, and continue nursing throughout the afternoon, continuing the jobs that we've done through the morning, emptying drains, catheters, that kind of thing, and doing any observations that need doing. Around that as well, we obviously feed the patients, and that can be via a number of means, whether they've got an NO tube, an esophagostomy tube, or a PEG tube, or obviously hand feeding. We have a fabulous team of patient care assistants which help us with our hand feeding and tempting patients to eat. They also help us to provide our patients with lots of TLC, including grooming and walking out. Throughout the day, we tend to walk patients out every 2 to 4 hourly, depending on what they're in for, what their condition is. If they're on lots of intravenous fluids, we can walk them out more regularly. And that continues throughout the afternoon and early evening until we do a handover with the night team at around 7:30. And then, as I say, the night team continue to nurse the patients throughout the night. Because we're a 24-hour hospital, our nursing care is just one continuous cycle. There's no real kind of break in between that. It's just a continuous cycle of nursing our patients, doing different things that the nurses do.
Thanks, Hannah. Now, for many pet owners coming in, it can be a really concerning and worrying time when their pet is ill. Obviously, communication with owners is a really vital, important role. Is that something that as a nurse you join in, participate in with?
Yep, definitely. Quite often, if the clinician is particularly busy of a morning, they will ask us to phone the owners, which we will do, and then they may give the owners another update in the afternoon. The owners will get a call every day, depending on whether it's from a nurse or from the clinician, including weekends as well, because we understand as nurses how worried owners can be about their patients, about their pet.
So can owners come to visit on site?
Absolutely, yes. Under normal circumstances, that's absolutely fine, and we actively encourage owners to come in and visit their pets. We have a massive outdoor area with picnic benches, so owners can come and sit with their pets and help to tempt them to eat if they're struggling with that. They can also, there's areas to take them for a walk, but obviously with the pandemic on at the moment, we are unable to have owners on site to visit their pets.
So is there anything that we've been doing during the pandemic just to kind of create that bonding experience? Have we been able to send photos and that sort of thing to owners?
We have been sending photos to owners of their pets, because as I said before, it is a very worrying time for owners when their pet's in hospital. So yes, that is something that we can do. We can't promise that we'll do it every day, but we will try our best to do it when owners request it.
So some of the pets that come to stay at Davies may be coming in with medical conditions, but for others, they may need to go to theatre to have a surgical procedure performed. Nicole has already mentioned that she works here within our theatre suite. So Nicole, would you like to tell us a little bit more about what your day-to-day job involves, please?
Yes, of course. So as a theatre nurse, I feel it's very important to have a really good knowledge of what the procedure actually is for that patient. This makes it a lot easier for me as a nurse, so I can be ready for every eventuality. We have rigorous protocols in the theatre setting to check the theatres, to check the anaesthetic machines, and to check the procedures that are actually being performed. The nice thing about being a theatre nurse is that we can see the case all the way from the start, all the way through the procedure to the finish and handing over back to the ward nurses.
So along with monitoring anaesthesia, sometimes what other roles will you do? Will you be assisting by passing the surgeon instruments and that sort of thing? And sometimes will you be scrubbed into the actual procedure?
So once the patient is asleep or anaesthetised, we move through to the surgical theatre, and that's where once the patient is really settled, we will open surgical kit and we'll hand things to the surgeon in a sterile fashion. Very occasionally we will be a scrubbed assistant, so we will have to aseptically wash our hands and don sterile gown and gloves and assist the surgeon, but we do have veterinary interns that do this on a regular basis. But one thing I do particularly enjoy being a theatre nurse is doing the surgical preparation, and that would involve clipping the patient's fur and surgically preparing it with an antimicrobial agent to make sure that that area is as clean as it can be prior to surgery.
We've spoken now about patient ward nurses and theatre nurses, but we also have diagnostic nurses here. And so they're involved with diagnostics which may be done on your pet to diagnose a particular problem. So things we're thinking about here are things like endoscopy, ultrasound and radiography, to name just a few of them. We also have some nurses who particularly specialise within a very narrow field here. So examples here are dental nurses who've taken additional qualifications to really focus on that particular specialism. We also have our chemotherapy nurses here, our radiography nurses, and we also have a bereavement nurse. So for some of those people who may not be knowledgeable on what that sort of role entails, Hannah, can you give me a little bit more detail about what the role of the bereavement nurse would be, please?
We have a dedicated bereavement team here who will keep in frequent contact with owners after their pet has sadly passed. They are available to give the different options that are available and to talk them through each step of the way through this process.
Thank you. That must be a really difficult job, but potentially quite rewarding, I would imagine.
It is a difficult job, obviously, and can be very tricky sometimes with owners on the phone, but it's a very, very sad and hard time for owners. So it's important to have knowledgeable people in place able to give that information, to give the right information at the right time.
Thank you. One of the other roles we have here as well is the dispensary nurse. Nicole, can you give me a little bit of a background as to what their role is, please?
Yeah, sure. So again, as Danielle has said, we have dedicated nurses for this specific role. They've undertaken extra qualifications. It's a job that they will do every day, 5 days a week. They're highly knowledgeable about all the drugs that we have in the practice, and we have a lot. And the dispensary nurses will also help the theatre nurses. When we're taking one of the patients back to bed, we can give them a script and they will kindly put up all the medications there for us, ready for that patient when it's woken up from its anaesthetic.
So today we've been focusing on the roles of the veterinary nurse here at Davies, but certainly it's a whole team approach here, and we're supported by various different members of staff. Many of you will have already met our amazing clinicians here on site, but there are a number of other roles which many of you won't get to meet. Hannah's already mentioned our patient kennel assistants here. But we're also supported by technicians who are working both in theatre and in diagnostics, who provide invaluable support in setting up for procedures and helping with us during our day-to-day roles. We also have a number of members of staff working in our client care team and our finance team, and they will be involved with things such as answering your telephone calls when you phone in, and also dealing with the admin side here. Other roles include our physiotherapy team, who are very much focused on rehabilitation of pets, particularly if they've had surgical procedures here. They may go down there to be provided with support and ongoing outpatient support once they go home to yourselves. And there are a number of other roles within the practice, and it's just a real team approach here. Is there anything that you would like to add with regards to sort of the important role of the team here at Davies?
I think, as Danielle said, we are a large team here, and not one department could work without the other one. Our patient care assistants in wards help us immensely with the pets when they're here visiting us. So some of the roles that the patient care assistants help us with are hand feeding, tempting patients to eat, lots of cuddles and lots of love. Sometimes when pets are staying here with us, they decide that they don't want to eat for any number of reasons. And it can be quite time consuming to spend the time with them trying to get them to eat. So in that situation, our patient care assistants are invaluable, really, spending that time with them. Lots of walking out, lots of grooming, lots of cuddles, any bathing that needs doing, anything like that. Very helpful for us.
Thanks, Anna. What about you, Nicole?
It's really nice, isn't it? Because they feel that they can really get involved with the care and that they're being part of that pet's time here. I feel in theatre, we've got theatre technicians that will help us get the theatre ready to make sure that that's ready to go. They will help us get the surgical trolleys ready. They will help us turn a theatre around so it's ready for the next case that's ready to come in, because we can have quite a number of cases come through theatre on a daily basis.
Yeah, they definitely help with the smooth running of things when it gets busy, don't they?
Absolutely. So we couldn't do it without all of their help either. So
great. Thank you very much.